How long do dental bridges last? Dental bridges are an extremely popular and efficient method to fill in damaged teeth and to improve the appearance and function that your smile. However, how long should you anticipate a bridge made of dental material to last? In this short video, we'll look at the aspects that affect the lifespan of a bridge made from dental material and offer some suggestions for maximizing the longevity of your bridge. 1. What is a dental bridge? Before we get into the lifespan of dental bridges, we must begin by defining the definition of what they are. Dental bridges are prosthetic device used to fill the gap caused by missing teeth or a number of missing teeth. It is consisting of two crowns or more which are placed on teeth that are adjacent to the gap, also known as abutment teeth. They also include false teeth or tooth called pontics, which are attached to the crowns to fill the gap left by the tooth that is missing or teeth. Dental bridges are made out of a range of different materials such as porcelain, steel, or a mixture of both, and can be custom designed to fit the shape, size, and shade of your own teeth. 2. Factors that can impact the lifespan of a dental bridge. Many factors affect the length of time a bridge lasts. This includes dental hygiene. Good dental hygiene is vital for the long-term health of a bridge made from dental material. Failure to floss and brush frequently can result in the accumulation of plaque and bacteria on the bridge. This could cause gum decay as well as diseases. It is essential to wash the bridge with care. Special dental floss or an interdental toothbrush to get rid of any food particles or plaque that might build up. Food. Consuming a diet that is high in acidic and sugary foods could accelerate the degrading of the material used to construct the dental bridge. Beware of these kinds of food, as well as maintaining a healthy and well-balanced diet will help extend the lifespan of the bridge. Clenching and grinding. The habit of grinding your teeth or clenching them could put too much stress on the bridge of your dental and cause it to break or loosen. If you tend to grind your teeth or use clenches, using a night guard that is custom made for you during your sleep could aid in protecting the bridge. Regular dental checks. Regular visits to your dentist to have cleanings and checkups is essential to maintain the longevity and health of your dental bridge. The dentist is in a position to assess the health of your bridge and fix any problems before they turn grave. 3. How long can you expect a dental bridge to last? A dental bridge will last between 5 and 15 years or more when properly maintained and cared for. The lifespan of bridges is contingent on a number of elements, such as the materials it's made out of, the position of the bridge inside the mouth, as well as the level of care it receives for. Porcelain bridges are known to last longer and more robust over metal bridges because they're less susceptible to chipping and wear. But they are costly and might not suit every patient. The bridges located at the back of the mouth, where they have to endure more bite and chewing force, might be less durable than bridges located in forward of your mouth, which are less stressed. Brushing regularly and flossing on the bridge's edges, staying clear of food items that are sticky and hard, as well as visiting your dentist regularly to checkups and cleans will assist in extending the lifespan of your dental bridge. 4. What happens when a dental bridge needs to be replaced? If a bridge for dental use reaches the point of no return or starts to show indications of wear or damage, the bridge may have replacement. The procedure of replacing the bridge will be similar to the original placement of the bridge and usually requires the removal of the bridge and constructing a replacement to match the existing teeth of the abutment. The dentist working together with you to decide the most appropriate course of action to replace your bridge depending on your specific requirements and preference. Dental bridges are a durable and efficient solution to replace damaged teeth and to restore your smile. If you take good treatment of your bridge and adhering to your dentist's suggestions regarding maintenance and regular checkups, you will ensure the bridge will last for years to be. If you are concerned regarding the longevity of your bridge or have any problems related to it, make certain to speak with your dentist to receive personalized advice and treatment.